This is a UN interagency team that came to assist the country in thinking about how to go about addressing the non-communicable diseases and its risk factors.
This is the first time I've seen, such a very unique group, coming together. When you hear the UNAIDS, World Bank and WHO, UNFPA, it's not every day you find such a group and working so, cohesively together.
It's really wonderful that this mission is coming here, and we hope that we would benefit from the strategies that this mission would be elaborating to refine our programming and also, the implementation phase of our programs relative to NCD.
NCD is increasing quite a bit, especially in the last 15-20 years, both in incidence, prevalence, and also burden.
In the last 10 or so years, we have seen very rapid the economic development and also social development. A lot of motorization. People are now dependent on motorized transport, which is actually increasing our risk for non-communicable diseases. The other thing is the increased risk of consumption of unhealthy food. And the other aspect is increased consumption of tobacco products, particularly smoking. And the other risk factor is the issue of increased alcohol consumption. So we have a lot of work to do to raise the awareness too, not only at the personal individual level, but also at the community level and also at the policy level.
UNDP became involved in the NCD response when the political declaration, the high-level meeting on NCDs happened. There was a realization there that NCDs are not a quintessential health issue, but more of a development issue, and the factors that determine person's susceptibility to non-communicable diseases is decided to a great extent beyond the health sector.
This is especially hypertension, diabetes, and the complications of hypertension and diabetes, such as heart disease, stroke and kidney disease, and also cancers now are really increasing.
NCDs quite clearly include cervical cancer, and as we speak in the globe, 500,000 women every year suffer from the consequences of cervical cancer. It is an incredible challenge, but we just feel that it's not insurmountable. And this is where the interagency partnership with WHO, with UNICEF, UNFPA together, we can really change that paradigm.
It is very important to make sure that there are best buys with the resources that are available to start with, because prevention and primary level management, in fact, just roll of aspirin in managing some conditions. There are very simple things, diabetic foot care at primary care level.
We've learnt a lot, we've seen a lot, and we believe now that the stars are aligned here in Kenya for you to really move to the next phase.
NCDs are no more WHO's, affair. It's become now an interagency affair, and it really requires a collective and concerted effort to tackle issues related to these non-communicable diseases. So it's a development agenda, and as development agenda, all agencies should come together and try to see on how they can fit into the puzzle.